It's Plush Tonight, showcasing the latest in professional spa treatments from Plush Medical Spa, Westgate Parkway, Dothan. With owner and medical director, Dr. Amanda Bell, board certified in internal medicine. Here's Dr. Bell with your host, Barbara Kennedy.
Hello, I'm Babs Kennedy, and welcome to our first episode of Plush Tonight. We're here at Plush Medical Spa on Westgate Parkway in Dothan. It's the most complete medical spa in the Ryegrass area. On this show tonight, we're dedicated in talking about what we do here at Plush Medical Spa and also the highlights of the hottest topics in anti-aging and beauty. Dr. Amanda Bell is our owner and medical director here at Plush Medical Spa. She's a medical doctor of 10 years and is board certified in internal medicine. Dr. Bell, tell us about what goes on here at Plush Medical Spa and what services you provide.
Well, first of all, let me tell you that we're located at 548 Westgate Parkway in Dothan. We're right next door to the Butcher's Block and across the street from Westgate Park. We're open Monday through Saturday, 9 a.m. to 7 p.m. And we have a great website, www.plushmedspa.com, where you can get much more information on all of our services and even buy gift certificates. We have a fan page on Facebook where we post all the latest discounts and news and things going on with the spa. So if you're a fan on Facebook, you'll find out everything first. We also regularly run specials just for our Facebook friends. And right now we're offering 10% off on all services and products for our Facebook fans through the end of February. We always offer 10% off to military and military families on all of our services and products as well. We have a beauty blog where we post all the information on everything we're going to talk about in the episodes we're going to be having here, but also extended information on winter skincare and just about anything you can think of. And that's www.plushmedspa.blogspot.com. So, to answer your original question, we have estheticians here at the spa that are responsible for all the skincare consultations. They do facials and microdermabrasion and chemical peels. Chemical peels ranging from the very mild glycolic or salicylic peels all the way up to the very strong TCA Plush Purple Peel. We have all Obagi medical skincare lines here. The Nuderm, the Condition and Enhance, the Cleansiderm for acne, the Rosaclear for rosacea. We have the CRX systems as well as the C serums. We have Elastoderm, and our representative, Michelle Keese, will be here today, and hopefully we'll get to meet her. We also have the area's largest selection of Jane Iredale cosmetics, and these are the cosmetics that are generally only carried by physicians, and they're very good for your skin, containing antioxidants and all pure materials and minerals, and you could actually eat it if you were stranded on a desert island.
Wow.
But we also do manicures and spa pedicures here. We have an excellent nail room that's very private. It has a large screen TV, and we have free Wi-Fi throughout the medical spa. If you bring your laptop, you can surf the web while you get your pedicure. We do face and body waxing, quite a bit of it actually. We do traditional bikinis and Brazilians. We do face waxing, eyebrow waxing. We even do back waxing for the gentleman, arms, legs, any part of your body basically. We have 2 massage therapists here at all times. They offer Swedish deep tissue, hot stone massage, prenatal massage. We do couples massage as well, and we have a very nice couples massage room for that.
Oh, that's nice.
I personally am responsible for the BOTOX and DYSPORT injections and injecting the dermal fillers, Restylane, Juvederm, Radiesse. I also do the Thermage CPT skin tightening treatments, and I see patients for dispensing Latisse for eyelash growth and Retin-A and other skincare medication.
Let's talk about Botox. What is Botox?
Well, Botox is botulinum toxin type A, one of the most powerful toxins in the world. It's been used in medicine for a very long time, and basically the toxin binds the receptor in the muscles to either weaken or paralyze them to stop movement. We use Botox in the face to weaken the facial muscles that are causing wrinkle formation. It's been used for cervical dystonia, problems in the neck, excessive sweating in the palms and underarms. It's used for eye problems like blepharospasm. It's used for chronic migraine, and it just achieved FDA approval for that last year. So we at Plush use botulinum toxin in 2 different forms. We use BOTOX, which has been on the market since 2002, and we use another form of botulinum toxin A called Dysport. It's been on the market for about 1.5 years, at least in this country. Around the world, it's been used under the name Relaxin for pretty much as long as Botox Cosmetic has been used for the same purpose. We can weaken the facial muscles, and millions of women have discovered what we already know. You can get a perfectly airbrushed look without sacrificing expression. You don't have to be mask-like or frozen. You can get a great result from an experienced practitioner. So Botox and Dysport are the 2 types we use here. Dysport is less familiar because it hasn't been around as long, but we tend to like it a little bit better, mainly because it works a little bit faster than Botox. With Botox, you generally have to wait 2 to 3 days to see any sort of decrease in muscle movement. With Dysport, you usually see a decrease in motion of those muscles after about 24 hours.
Dr. Bell, what areas can you treat?
Well, we generally treat the 3 major areas in the upper face. I have a diagram here I can show you. The most common area to be treated is the glabella area, which is the area between the eyes. People typically have horizontal lines here, vertical lines here, and by injecting into the corrugator muscles, we can stop this inward motion and the folding of the skin there. And it's quite easy to treat this area and, in most people, completely remove those lines. Now, Botox and Dysport really only treat the lines that are caused with motion. But certainly the lines that are there at rest can be softened somewhat by removing that basal tone in those muscles, and by keeping that area still over time, your body has time to heal in the lines that seem to be permanently there. The other area we treat is the forehead. People typically have horizontal lines running across the forehead, and we can treat these frontalis muscles here, usually with injections fairly high in the muscles. We use a smaller dose for the forehead than for between the eyebrows, so that we less affect the position of these eyebrows. When you fully paralyze the muscles up here, you take away the support for the eyebrows, and we worry about you getting a drop in your eyebrows. So we tend to dose the forehead at very low doses and keep the injections high in those muscles.
Does it hurt?
It can hurt, but only for a second. Generally, the injections take about 30 seconds, and it's a very tiny needle. So generally, people are quite surprised at how easy and relatively painless it is. The third area we treat is the crow's feet, and we generally do 3 to 4 injections around the crow's feet.
Wow.
To widen the eyes and to eliminate the lines radiating out from the side of the eyes. So in general, while there are exceptions to the rules, Botox and Dysport are used in the upper face, whereas we tend to use fillers for volume replacement in the lower face.
In the lower face.
It's typically a bad idea in general to use Botox or Dysport around the mouth or in any area that's going to affect the smile muscles.
And how long does it usually last?
Most people get 4 months out of Botox or Dysport. The vast majority, I would say. Some people are very lucky and they can get up to 6 months out of a single treatment, and some people are unlucky and only get about 3 or 3.5. By and large, people get 4 months, but it's really up to you and how quickly you regrow the receptors that have been inactivated by the toxin.
If I were to come in here and have Botox to support treatment, how soon will I get the results? And will people really notice a difference?
Usually what people notice is that you look refreshed and rested, and they can't quite figure out why you look so good. Some people who have had the treatments before may be more likely to notice it in you.
Okay.
But in general, once you leave here after your injections are done, you will have no outward signs of having had it done. You can go right back to work or right back to whatever you were doing, and no one will be the wiser.
You don't have to go home and hide yourself for a little bit.
The only
you
thing,
can go right back to work.
The only thing we ask is that you don't go home and lay down, and that you wait about 8 hours before laying down to reduce the rare problem of spreading of the toxin.
Okay.
Generally, that's the only side effect that we would worry about, and an experienced injector will be well aware of all the caveats to treating you.
So the bottom line question is, how much does it cost in each area?
To treat glabella, the area between the eyebrows, generally we use the standard dose. It typically costs about $195 with Dysport and around $225 with Botox. Generally, any given area you treat is going to be about 10% cheaper with Dysport because they simply charge us less for the drug.
Wow.
To treat your forehead, we tend to use lower doses, and that usually requires about $130 to $180 to adequately treat that area, depending on the drug you choose. For the crow's feet, there is a standard dose of about 10 units per side, which turns out to be around the same amount as doing between the eyebrows. So you're looking at $195 to $225, depending on the severity of your crow's feet.
Those are pretty good prices.
We do tend to have the best prices in town. We also run specials all the time. We have coupons running regularly in the Dothan Eagle, and we have our specials displayed on our web page, specials page at plushmedspa.com. We also have a rebate going on right now with Dysport, where you get $50 back on any size treatment, no minimum number of units. You get $50 back through the mail. And that will be running through the end of March 2011. But I do have to tell you that they frequently run rebates about 3 times a year. So it's always easy to either use a coupon and get in on a rebate and save yourself a significant amount of money off our already good prices.
That's awesome.
Yeah, we have fun here.
Yes. And I hear that Dysport is really, really good. If anybody hasn't tried it, they should.
We have gotten excellent results from Dysport. I have to say that it has been what I've used on myself the last 3 times I've done my treatments. And yes, I do my own treatments. I treat this area. I cannot make the lines there. I treat my forehead, and while I can't make lines in my forehead, I still can raise my brows somewhat and express myself. And of course, I have no crow's feet. So Botox and Dysport have helped me for a long time maintain the look I want to maintain. But the last few times I've done my treatments, I've used Dysport and been more than pleased with it.
Imagine that, you inject your own self. I could never do something like that.
I'm a bit of a control freak. But we do have a couple of patients here today that we are going to show you a Dysport injection on, and hopefully you'll enjoy that. Today I understand you want to do all 3 areas.
Let's do it.
Because you loved it so much the first time, right? Everybody does. All right, well, let me take a quick look at your muscles here and see exactly how many units I think you're going to need.
Okay.
I know with your crow's feet before, we used a pretty standard dose of the equivalent of 10 units of Botox on either side.
Right.
And I think that's fine. As long as you are satisfied with the results, I don't think there's any reason to use more or less. I think that's probably the right dose for you. It's the right dose for just about everyone.
Okay.
Put your brows together for me and let them go, and then put them together as hard as you can. Okay, so you do have some line formation there, and it does tend to make you look a little bit angry. Lift up your brows and lower them, and lift up and lower them. And one more time. Most of your wrinkling in your forehead is in the very top of your forehead, which is the ideal person for treatment with Botox or Dysport in that area. Because your lines are up there, we can basically treat the top portion of your forehead without treating the lower portion, and thereby not dropping your brows very much at all.
Okay.
You should still have some retained motion above your brows as well, which you know, is ideal.
Okay.
And nobody wants to be frozen.
Okay.
All right,
Good.
so that's what we're going to try to do. Because we're doing your forehead and because eyebrow placement is always an issue, You know, a difference in diffusion can cause one eyebrow to have a little bit of extra tone in it. So we see you back at a week, and we do any small touch-ups that need to be done. Okay. Only about 1 in 5 people end up needing a touch-up to their forehead, but certainly if you're the one of those 5, it matters a great deal to you. Sure. So if you don't need to keep your follow-up appointment, if everything's perfect, you can cancel it. Okay. But otherwise, come back and see me. We can do a very small free touch-up to get you exactly where you need to be. Okay. Sound good? Sounds good. Well, I know you've signed your consent form. Right. Do you have any questions at all?
I think I'm fine. Let's do it.
All right. Well, I know you've had it before, so I didn't expect you to have questions, but I always want to lay it out there. You do remember that when the needle goes in, it's a very tiny needle, so you'll just feel a small pinch, but you may hear a kind of crunching sound.
I remember that.
That is the needle going through your collagen layer, and it's absolutely nothing to worry about. In fact, it's a good thing. If you have collagen, you crunch, and collagen is always good for our skin. Okay. So let me clean you up with some alcohol, and we'll get to your injections, and as you know, it's very quick. Yep. All right. Get my purple gloves ready, and the alcohol, and we will get going on you, my dear. Okay. How's your life been treating you?
I'm all off been treating me just fine.
Well, I know you're a busy lady, so you must be going all the time. Pretty.
Thank you.
All right. We've got some alcohol pads here, and we're just going to clean up the areas that we're going to inject. I know you've taken off most of your foundation, and that helps, but really we just want the areas where the little sticks are going to be as clean as possible. Sure. There's almost no chance of getting an infection from such a superficial injection like Botox, but certainly we want the area to be clean. So are you nervous? Almost everyone is nervous.
Oh, I'm sorry. Okay, I'm nervous.
No, it's great. It's great if you aren't nervous. But I mean, you've had
I trust you.
You've had it before in your crow's feet, so you know how easy it is.
Yes,
most first timers, are quite nervous, and that's normal. But everybody goes out thinking how easy it was, how silly they were to have been so nervous about something so small and easy. All right. Any preference as to which area we start with?
I don't. It doesn't matter at all. Do whatever you think's best.
All right. Sounds good. Well, right here I have a sufficient amount for your crow's feet, so I think we'll go ahead and do those with this injection. What I'd like you to do is turn your head slightly that way. Great. And smile for me. Good. You can see that muscle right there very easily in you when you smile. Go ahead and squint for me as well. Just squint like it's sunny. Very good. It's important that you spot the exact location of the muscle because it's very thin and you certainly don't want to miss it or you'll be wasting your treatment. This is Dysport we're using on Shauna. So squint one more time for me with a smile. There you go. And let go and relax the area as much as possible. Here's your first injection. Okay? Okay. Most people do not bruise with Botox or Dysport, but if they're going to, the area that will be most likely to bruise would be this area around the eyes because there are a lot of small vessels coming out from the eye area. You have a tiny little bleeding out of one of those spots, and so I'm just going to clean it off. Put a little bit of pressure on there so that you won't potentially get a bruise. And we'll move to the other side. Okay. So far, so good?
So far, so good.
Good. You come around here. Excuse me, my dear. Great. Same thing over here. Just go ahead and smile. Great. I can see the muscle nicely. Here goes your first injection. Second. Third. And last. There you go. All right, one area done. Move on to your crow's feet, your glabella area and your forehead, and you will be done, miss. I need another alcohol pad, sorry. right. I'm just a stickler for clean, Shauna.
Well, that's good.
I like to re-clean
We like
areas.
clean.
Right. Clean is good.
Clean is good.
Especially when you're inserting foreign bodies into you. Right. All right, now put your brows together. Good. And let go. And now put them together again and let go. All right. Here comes your first injection, going into the corrugator muscles that pull the brow together medially. These are the ones that cause the majority of the vertical lines that people get in this area. But there are also small depressor muscles that create the semicircular portion to those vertical lines at the lower half, and we treat those as well. So surprisingly, a lot of injections for the central area there between the brow, because there are multiple muscle groups that we're treating. Did I make your eyes water?
You made my eyes water.
I'm so sorry.
That's okay, that's okay.
You're just a delicate flower.
That's me.
All right, so onto the forehead.
Okay.
We'll let you ooze a little bit there. There's no problem with doing that. So we have you raise up and lower, and here's your first injection. Raise up and lower. Here I'm targeting the area at the side of the brow. If we don't go far enough laterally here, we'll regret it because you'll end up looking like a Batwoman. Lift up and lower. And lift up and lower. There you go, my dear. You are all finished. So how was it? Excruciating?
No.
All right, yeah, it's really not a big deal. Some people tend to ooze like this a little bit. Those people tend to be people that bruise easily. But usually within about 2 minutes, these areas stop oozing a little bit. And you can see where the volume was injected. After about 15 or 20 minutes, any evidence of that volume will be gone, and no one will be able to tell you've had anything done today. Fine. So it's been a week, and we did all 3 areas on you. So let's see what we've got here. Raise up your brows. Okay, you've got a little bit of motion left here on the sides, so you can kind of lift your brows laterally. Put them back down and lift them up. If you like, we can touch that up a little bit to get them back down, or I actually think it looks kind of nice this way with you having a little bit of motion over there. You're not wrinkling the skin. Put them down and lift them up. Yeah, it's just slide. I think that's almost nice to leave that. It gives you more of a natural look where you can express a little bit. Now put these together for me. No, seriously.
As much as I do.
Well, that's perfect, obviously. You're not making any angry lines there anymore. Perfection. Turn a little bit this way and smile for me. That's great. Only lines you have on the side of your eye are coming from cheek motion right down here. There's certainly nothing coming out the side of your eye. Now squint and smile real big. Yeah, nothing at all coming out up there. It's all coming from cheek motion. So that's the best we could expect with all of this.
Good. I'm proud of it.
All right, very good.
Very pleased.
All right, well,
Thanks.
come back and see me anytime.
I will. Thank you so much.
Thank you, Dr. Bell, for educating us on all about BOTOX and Dysport. I mean, this has been great. And thanks to Shauna and Jim for being our guinea pigs and being
allowing
on the
us to
show.
stab needles into them.
Absolutely. And just please stay tuned to our next episode, because the next episode is going to be about the fillers. So make sure you tune into that, and we'll see you then. And thanks. Bye.
This has been Plush Tonight with Dr. Amanda Bell. Thanks for watching.